Yeah, and the
Okay.
birth control pills can cause more than just those side effects. I mean, we get calls from providers all the time that somebody's on birth control pills and they're having all these sexual health symptoms and they're having or depression and many other side effects from birth control pills, and they want to balance their hormones. Well, I mean, honestly, the first step is really you got to get them off birth control pills because you really shouldn't be prescribing, try to prescribe something to overcome all the side effects of birth control pills. What are your thoughts on that?
I think that's absolutely correct because you cannot correct birth control pills adding something on top of it. I mean, the birth control is pretty potent, and if you're gonna stay on that, then you're just gonna. It's like you're chasing your tail, and it's frustrating because then if you try to, even with bleeding, when they get breakthrough bleeding with that, and you try to chase with hormones, it's just frustrating and it's tough to get them cycling, let alone what's going on in the rest of the body. And one of the interesting things is they actually did a study on women that were on birth control pills versus the population that wasn't. And they realized that in our brains, how we select out our mates, so our partners for life. And when you looked at women that were on birth control pills and when they weren't, they actually selected different partners. And they actually not saying, oh, I'm choosing a riskier partner, but it changed the brain's selection mode for how you choose a partner. The interesting thing is then when they discontinued it, they noticed there's an increased risk of a rate of women breaking up with their current partner or divorce rate, which I found was interesting because it's showing the dynamics of the hormones, how they affect the brain are substantial.